Assalamualaikum and very good afternoon to all. My name is Dr. Syarifah Aisyah binti Abdul Halim. I am an anatomy lecturer from Universiti Kebangsaan Malaysia. So currently doing my PhD at USM under supervision of Dr. Siti Nurma. She's also here, and also Dr. Saiful and Dr. Hanis. Before I start, I would like to say thank you to the MAIMS for giving me this opportunity to share my research finding in the MRHS platform. Okay, so today I'm going to present my research finding, which has been published in the Journal of Taiba University Medical Science, entitled Clinical Students' Reflection on the Preclinical Anatomy Learning Experience. So here are the team members of this project, and this project has been supported financially by the FRGS. Okay, as we know, anatomy is the oldest anatomy is the oldest subject in the medical curriculum. It serves as the foundation of the medical knowledge to prepare the student before they enter the clinical practice. So having an adequate anatomy knowledge is very important because anatomy content actually underpin the concept of body function, pathological condition, diseases, physical examination, and also clinical procedure. Some studies also have mentioned that the anatomy course also promoted the student to develop professional behaviors and competency pertinent to the clinical practice. Okay, however, with the advance in the medical education research and practice, modern anatomy curriculum has faced many challenges. First, we know that the anatomy has to meet the need of the curriculum despite reduced anatomy contact hours. And then second, as the cadaveric dissection has become less feasible, so we need to incorporate other learning pedagogies and learning teaching method to ensure the anatomy can be delivered effectively to the student. So there are many latest pedagogies such as problem-based learning, DBL, digital anatomy software, and also active learning pedagogy such as interactive lectures and also body printing. Okay, in Malaysia per se, so in Malaysia, the many university actually implemented integrated curriculum, student-centered approach, and also problem-based learning in their curriculum. And anatomy is taught in the first 2 years out of 5 or 6 years of the medical program. And then the anatomy knowledge is horizontally and vertically integrated with the medical curriculum. For the horizontal integration, the anatomy is taught together with the other preclinical subject such as pharmacology, physiology in a same block. For the vertical integration, it can be achieved. Vertical integration of the anatomy can be achieved through PBL, where the student has to discuss on the disease. And it also can be achieved through the CSL, clinical skill laboratory, where they have to perform a procedure on the mannequin. So they had the opportunity to apply their anatomy knowledge in the protected environment. And lastly, the teaching modalities in each institution in Malaysia actually varies. Some of the institution, for the practical session, they rely heavily on the cadaver or prosthetic specimen. But other institution, they use the plastic model and some of the institutions, they have upgraded in, as they incorporate the digital anatomy software with their teaching. So, although we said that anatomy curriculum in Malaysia is already integrated, but the medical student still had difficulty to apply the anatomy knowledge in the clinical years. So, in this study, we want to explore, to uncover the gap in the current anatomy curriculum associated with the anatomy core competency to support the safe clinical practice from the perspective of the clinical year student. Okay. So in this study, we expect the student to reflect on how the preclinical anatomy training had prepared them for the clinical attachment. So we want the student to answer 2 research questions. First, how has anatomy learning during the preclinical phase influenced the student's clinical practice? And how did the student use their anatomy knowledge and skill in their clinical practice? So for this study, we adopted the focus group discussion, which is one of the qualitative method to answer the research question. So basically, focus group is actually consists of a group of individuals that are selected and assembled by the researcher to discuss and to comment upon certain issue on their perspective, on their own personal experience. So we think focus group is a best method to explore the anatomy experience by the student. And we use the purposive sampling, where we purposely select the participant to involve. Basically, the participant involved need to have a certain inclusion criteria where they can give enriched information to the researcher. So the inclusion criteria we selected are the final year medical student, and they have undergone all the major clinical posting. We have recruited 40 students from 5 institutions. So basically, these are the universities that agreed to involve in this study. Okay, we conducted 5 focus group. Each focus group were conducted at each institution. So we had a homogeneous participant. Because this is very important, because we want to provide a secure environment for the participant to share their opinion. So, and then the numbers of the focus group conducted actually was guided by the saturation, because according to the Hennig and Kaiser, the data saturation can be achieved between 4 to 8 focus group discussion. And saturation is the saturation has reached when the student has repeated the same information again and again. And due to the COVID-19 pandemic, we conducted the FGD session using the WebEx. Actually, there is a study have been conducted to see the efficacy between the face-to-face and online focus group. So basically, they said the synchronous platform actually can provide almost similar to the physical focus group, because through the synchronous platform, we can also see the audio and also the visual cues from the participant. Okay, before the conduct of the FGD, we had prepared the protocol, which consists of the research objective, and then we listed a list of questions that can answer the research question, and then we identify and recruit the participant. And before the conduct, on the day of conduct, we also prepare the recording for the session. Okay, prior to the session, make sure we make sure that we already get the informed consent from the student, and the session was started with the introduction of the moderator and all the participants. And all the participants were given a name code to remain the anonymity of the study. And then after the session, we have to transcribe the FGD session into the written form and upload it into the Atlas TI. And then the transcript will analyze according to the 6 steps of the thematic analysis. Okay, so from the study, we have generated 6 themes. The first one is the regarding the preclinical anatomy learning experience. The second one is the anatomy content and teaching. Anatomy, number 3 is anatomy related competency. Number 4, importance of anatomy knowledge for clinical practice. Number 5, importance of early exposure to clinically applied anatomy. And lastly, suggestion for future improvement. So the first one, so under the preclinical anatomy learning, there are 4 sub-themes, which is positive and poor learning experience, learning method practiced by the student, and also difficulty faced by them. Okay, for the positive learning experience, basically most of the students they actually love they admit that the anatomy learning environment at their institution is very good. They had fun learning anatomy. One of the students shared her excitement where she said that the cadaveric specimen helped them to understand anatomy because they can visualize what they learn in the real human body. And because of this positive experience and good environment, it can stimulate the anatomy knowledge recall. Okay, the second sub-theme also is a poor learning experience. Okay. Some of the some of the students also admit that they had a poor learning experience while learning anatomy. They said that one of the students shared that they had limited opportunity to learn to apply the anatomy knowledge and skill during preclinical years. She said, to be honest, not everyone had the chance to perform the physical examination or clinical skill on the mannequin. It was different when we learned the anatomy theory because we didn't apply anatomy. So they felt that they learned for the sake of the exam. And some of the students said because of the difficulty to memorize the structure, they had lost the intrinsic motivation to learn anatomy. Okay, and then the third sub-theme is the way of the learning by practice by the student. Okay, most of the students said that they learn anatomy through rote memorization. And one of the students expressed, she said that because of the rote memorization had resulted into poor anatomy retention during the clinical years. She said, when I entered the clinical years, it was quite hard for me because at the time I just realized that I only memorized the anatomy information during my preclinical years. So other students said, apart from rote memorization, they also learn anatomy through animation, through the applied anatomy knowledge, observing procedure, PBL, and also peer discussion. And okay, the last sub-theme under the is the difficulty faced by them. Okay. Okay. Most of them said they had difficulty to recall the anatomy knowledge. Okay. For example, this is the student said, when we were in the operation theatre, the surgeon would ask, "What layer is this? What structure is this?" I could not recall which was what. It looked different from the picture in the slide, textbook, and atlases. So when I entered the clinical years, I learned a lot. Other than difficulty to recall, they said they had limited opportunity to apply anatomy knowledge and skill during preclinical years. They had difficulty to integrate the anatomy knowledge vertically and horizontally, and they said also it's difficult if we want to learn anatomy just through the didactic lectures. And okay, and of course, lastly, this one, learning anatomy is quite challenging for novice learner because they said Usually in the preclinical years, they learn anatomy through the 2D through 2D. But however, when they enter the clinical, they see the patient and everything in 3D, so they cannot relate with the resources that they had during the preclinical years. Okay, the second theme is the anatomy content and syllabus. So there are 4 sub-themes, which I will discuss only 2, anatomy content and syllabus, and also the anatomy teaching methods and tool. Okay, in general, about the anatomy content and syllabus, the student perceive anatomy as the dry, content-driven, and cognitively challenging subject. Okay, this one shared by the student. For me, learning anatomy during the preclinical years was difficult as there was a lot to learn. Everything was compressed within 1 year. It was difficult for me to connect the dot between anatomy and other subjects. Even though we had a clinical skill lab every week, it was difficult to incorporate what we had learned in anatomy into physical examination of the student. Okay, the second sub-theme is the anatomy teaching method and tool. Okay, most of the students agree the use of various teaching tools actually facilitated their comprehension in anatomy. Okay, one of the students shared, I remembered one anatomy lecturer used several methods when teaching us, such as drawing and also YouTube video. It was very easy to understand, and when I entered her class, the knowledge I learned in the video helped me to understand the class. And there are also negative quotation shared by the student where they said that if the lecturers deliver the anatomy content didactically, it actually boring, and even boring if there is a lack of the clinical relevance. So they said, one of the students said, I wish to cut down some of the boring lectures. I think most students would prefer to learn the details on their own. What is in the lecture can be found in the textbook. I think we can replace this boring lecture with some interesting activities or use learning software. So other than that, there are other methods that they suggested, they shared, where they learn anatomy through lectures and also practical session. They need to use the anatomy models and also cadaveric dissection for the practical, and video improve the visualization of the anatomical structure. Some of the students visited the anatomy museum, and they preferred learning with the living participant because those living participants actually appear different from the atlas and textbook. Okay. The third theme is related to the anatomy related competency. Okay, there are 2 sub-themes, which is the anatomy cognitive competency and also clinical skill. Okay, for the anatomy cognitive competency, actually the student have listed a topic that has a highly anatomy relevant to them during the clinical practice. However, I just wrote here 3 because these 3 are repeatedly highlighted by the student, which is the musculoskeletal anatomy, dermatome, and arterial and venous circulation. Okay, for example, one of this student, she shared, even though the musculoskeletal anatomy is very difficult and cognitively challenged during preclinical, but actually this topic actually very important for her when she go to the clinical posting. Okay, and then the third one is the clinical skill. These are the few clinical skills that they said we need the anatomy knowledge prior performing of the structure, performing this procedure. And then the fourth theme is the importance of anatomy knowledge for clinical practice in terms of the gross anatomy knowledge and also surface anatomy knowledge. For the gross, okay, they admit the gross anatomy knowledge is very important for doing in the clinical, for their history taking, to understand the pathophysiology, to increase their appreciation of the clinical finding, and also to conduct the clinical procedure and facilitate the diagnosis. And for the surface anatomy, okay, they said they applied the anatomy knowledge when they, especially the surface anatomy. Okay. For example, this student shared, I applied the knowledge of surface anatomy of the chest while placing the ECG lead on the patient. I need to identify the ribs and intercostal space first. And then the fifth theme is the importance of early exposure to clinically applied anatomy. So they actually feel that the clinical exposure related to anatomy is very important so that they understand anatomy better. And lastly, this is some of the suggestion of for the future anatomy suggestion. First, the use of the multimodal teaching and learning. So one of the students shared, when I was an exchange student in the Philippines, I learned through various methods. For example, when we learn about liver, we started with a lecture that related to the anatomy and physiology of the liver, and then we perform ultrasound on our friend to know how it looks like in the ultrasound, and then they go to the dissection hall for the cadaveric dissection. So basically, they need the multimodal teaching and learning, and also hands-on using various modalities. And another one is this really hope that anatomy can be learned longitudinally throughout the curriculum. For example, okay, they learn in the first 2 years. They hope that anatomy can be revisited during the clinical years. The student said, I think we shouldn't be learning anatomy within 2 years. It should be throughout the entire 5 years as a medical student. I think this experience would expose us to different kind of teaching and experience, and we can see how anatomy plays a huge role in the clinical practice. So in this study, we have identified, six themes, which is a clear indication how the anatomy preclinical learning had influenced the students' learning during the clinical attachment. We know that anatomy, most of the students during interview said that anatomy is perceived as a difficult subject. So this is in alignment with the previous studies that said that anatomy is viewed as the complex in nature. We know that the anatomy content is very excessive, but we also noticed that some portions were unnecessary for the clinical practice, and this sentiment was echoed by the many anatomy educators worldwide, because they said anatomy is rich with information, terminologies, and also the diagram is very complex, so it's very difficult. That's why there is an attempt by the anatomy worldwide to construct a core anatomy curriculum that outlining the minimum anatomy knowledge required for the medical student. And interestingly, in this study, we also identified several pertinent aspects of the anatomy knowledge and skill that are important for the clinical practice. Okay, despite the integrated, okay, we know that despite we claim that we are integrated, but we also, in the study, we also concerned about the limited opportunity of the student to apply their anatomy knowledge during preclinical years. And this, okay, even though, okay, for example, for the practical, we mainly use the modalities, whatever modalities that we have to help students to identify the structure, but we minimally expose to the modalities that are being used in the clinical, such as radiological modality and also procedural skills. Some said that we can introduce all these clinical when they enter the clinical years. However, there are studies showed that introducing a basic radiological and also clinical procedure in the preclinical years actually can strengthen the anatomy knowledge, enhance radiological and clinical skill, and also improve the student perception on the value of the anatomy. So from this study, we recommend that the continuous effort should be taken by the anatomists especially try to integrate anatomy teaching with the clinical practice. So before that, all the anatomists should have a mindset that we have to not to compress everything during our lecture. We have to handpick which one is relevant, highly relevant to the clinical application. And lastly, we hope that one day anatomy teaching could be run longitudinally throughout the medical program, so that during the clinical we also revisit the clinical content, clinical relevant, and during the clinical years we also can revisit the anatomy related to the clinical whatever clinical that the student learn during the clinical years. Okay, with that, I thank you. Thank you for your attention.